Take a moment to imagine the 35 trillion red blood cells pulsating through your body. 35 trillion tiny, reliable, concave, round bits. You trust them to carry the very essence of your existence, oxygen, seamlessly. It's this unspoken partnership that fuels your every breath, your every heartbeat, and it is the very reason I can give you this speech today. Now, take a pause, hear your heart beating. That's the red blood cells at work. And consider this. What if this harmony, this narrative, wasn't as harmonious as it seems? The truth is that red blood cells aren't always concave, aren't always round, and aren't always reliable. How often do you think about red blood cells? Not often, right? And why should you? They're these tiny, reliable, an army working tirelessly within us. But what if I told you that their story can take unexpected turns? What if the very essence of life, the oxygen you are breathing right now, is not as guaranteed for everyone? Just as you have your narrative as a healthy individual, there are hidden tales, struggles, and triumphs within the lives of those navigating challenges with sickle cell. Welcome to the unseen narratives of living with sickle cell disease, particularly within the diaspora. People who live in a different country from their original homeland. Let's first start by defining the condition. Sickle cell disease is a group of genetic disorders that forced me to become accustomed to the concept of heredity from a very young age. It has many different manifestations and is a disease that can be passed down from generation to generation. My mother is a sickler, and she passed down her gene to me. However, I have a less severe version of the condition called sickle cell trait. It's believed that sickle cell initially developed as a defense mechanism for a condition called malaria, which explains why it's more prominent in those from ethnic descent, particularly African, Asian, and Southern America. Sickle cell arises from the mutation of a gene that codes for abnormal hemoglobin, a substance in red blood cells that is responsible for carrying oxygen around the body. This abnormal hemoglobin causes red blood cells, our reliable, round red blood cells, to become hard and sticky and rather C-shaped, hence the name sickle cell. Due to this, abnormal cells block vessels, so not enough oxygen is transported around the body, resulting in a sickle cell crisis, which includes excruciating pain, fatigue, stroke, and other healthcare complications. By living as a carer for my mother in the UK, and as a sickler myself, I have borne witness to one of the most common genetic conditions in the world, but also one of the most commonly disregarded. Having seen my mother being categorized as clinically extremely vulnerable during COVID, but still waiting weeks to receive a trial drug, was an example of this. This is while we knew of people with chronic lung disease and obesity placed in the same category who only had to wait a day for the same drug. Classified as a rare condition, even though, according to the National Institute of Health, 20 million people are affected by sickle cell worldwide. I wonder how this constitutes as rare to you. Now, let us transport ourselves to the home of this disease, Africa, because this lack of awareness transcends more than just a race issue, or an unwillingness of the Western world to care for conditions affecting a minority population. This lack of understanding extends to Africa as well, where miseducation has meant that sickle cell sufferers are suffering at the hands of ignorance. Some countries in Africa do not recognize sickle cell as they do not have the technology to diagnose it and or have a large rural population. This means sicklers go untreated, making their condition worse. In addition, there's also a cultural stigma surrounding sickle cell. Some tribal communities, such as the Yoruba community where I'm from, may believe that sickle cell is caused by witchcraft. Thus, sicklers are punished not only by their disease, but by the community, with some even facing exile. This shows that sickle cell is more than just a genetic condition, due to the entwinement with race and the stigma of sickle cell within Africa and beyond. There is this stigma that sicklers are weak, they die young, They don't try. This means sicklers now embody this mentality. They don't participate in sports or academic competitions, all because of this toxic mentality that they can't. These sicklers account for 40% of the population. However, statistics are meaningless in the face of suffering. I encourage you all to listen and educate ourselves on conditions that affect those around us. There is such a transformative potential that lies in the simple act of rethinking. After all, global health is our health. After that detour to Africa, let's head back to the UK and return to my experience with sickle cell within it. Growing up with Nigerian heritage in the UK is an example of being a diaspora. I was exposed to a country with a seemingly strong healthcare system. And don't get me wrong, I'm grateful for the NHS, the healthcare service for those in the UK that's free for everyone. However, it unfortunately prioritizes the health of the ethnic majority. That is white and English people. Due to this, I and many others have experienced discrimination stemming from a lack of understanding. An example of this would be the case of Richard Okorogehi, who was forced to call the emergency service 999 from his own hospital bed after being denied numerous life-saving blood transfusions due to his pain not being taken seriously enough. This shows that healthcare professionals fail to take the suffering of a condition seriously enough, even though the pain that sicklers experience is excruciating, especially when they undergo a pain crisis. Now, despite the UK being a diverse and multicultural hub, with 46.3% of the London population being non-white, the only insight I had into my health was through my mother. She is a sickle cell sufferer who also works with people with sickle cell at one of the top hospitals in the UK. Through her viewpoint, I see that this issue is not just standalone. Seeing NHS healthcare campaigns about different conditions like cardiovascular disease and diabetes, for example, the diabetes prevention program, but never seeing sickle cell, I never felt represented. I never felt seen. This was impactful because it taught me that if I wanted to see change, I would have to take things into my own hands. Now, hands that audibly laughed when the first mention, and only mention, I saw of sickle cell was in my GCSE textbook under the topic of genetics. A passing comment about how sickle cell is classified as a good mutation under genetics. A good mutation, because those with sickle cell are less likely to develop malaria due to only some of their blood cells being sickle. This humoured me, a cynical kind of humour, that laughed at how the good and bad aspects of a disease can just be picked out and explained by people who have no idea of what suffering is like. I had to go out of my way to educate myself on my condition. Using events and resources from the Sickle Cell Society, which is the only UK recognised charity for sickle cell, that in itself is a testament to thinking, as well as giving this speech. But now, how can we do anything about this? To catalyse this much-needed change, our efforts must extend beyond addressing the physical aspects of sickle cell disease and dismantling the deep-seated stigmas enveloping it. Robust evidence, as presented in studies such as one published in the Journal of Pain and Symptom Management, shows a convincing correlation between patients with sickle cell and both race-based discrimination. This supports the view that challenges faced by those with sickle cell disease are not isolated incidents, but rather systemic issues with real consequences. Now, the dismantling of false narratives portraying sicklers as weak or destined to die young is not just a matter of correcting misconceptions. It's an urgent call to rectify the systemic neglect that lies within global health systems. Studies further illuminate the repercussions of discrimination, indicating that individuals who have experienced race or disease-based discrimination are 53% more likely to question and potentially resist following healthcare recommendations from their physicians. This underscores a fundamental breakdown in the patient-doctor relationship where discrimination is at play, raising valid concerns about the sincerity of healthcare advice provided. Now, As we delve into the complexity of race-based disease discrimination, it becomes crucial to address skeptics who may doubt the extent of its existence. To those hesitant about acknowledging this issue, let me tell you that instances of race-based disease discrimination are not merely isolated incidents. The abundance of studies on this matter and the ongoing discourse within the sickle cell community are resounding proof that these are systemic challenges, not outliers. While it is true that healthcare professionals are dedicated to providing unbiased treatment, the reality is that subconscious biases can inadvertently influence medical decisions. Such as when my mother was pregnant and had complications due to her sickle cell, and her pain wasn't taken seriously, as the doctor dismissed it as just normal pregnancy pain. Even though my mother insisted that this pain was not like before, but this resulted in numerous emergency operations, which revealed that she had severe internal bleeding. But she's one of the lucky ones. This is part of the reason why the maternal mortality rate of black women is the highest of any racial group. This should not be the case. It's essential to emphasize that the goal here is not to assign blame to individuals, but to bring attention to systemic patterns that contribute to health disparities. This isn't just an issue of race. It's an issue that compromises people's health and lives due to societal ignorance. Expanding this dialogue, it's essential to recognize that race-based disease discrimination is not confined to sickle cell survivors or a specific ethnicity. It permeates various communities, witnessing NHS campaigns about specific conditions, like the NHS Diabetes Prevention Programme, while others are being overlooked, has taught me that so much suffering remains hidden from my health violence. The narrative must shift from assuming that conditions affecting specific populations are less significant. We must not be deceived by preconceptions and unseen statistics. By challenging these misconceptions, we actively contribute to reshaping the narrative surrounding healthcare, emphasizing the equal significance of all conditions and promoting a more inclusive and empathetic approach. Now, imagine a world where discrimination based on the unique characteristics of blood cells, a mere 35 trillion tiny concave round disc, becomes irrelevant. Such a utopian vision sounds idealistic, right? But let me reveal the new reality, because this is not beyond reach. The realization of this new reality begins with each individual, including you, the audience. By actively engaging with this speech, you are taking a crucial step towards reshaping societal perceptions, fostering empathy, and contributing to the creation of a more compassionate and informed healthcare landscape. The strength, resilience, and tenacity exhibited by those living with sickle cell, as highlighted in these narratives, serve as a powerful catalyst to change. Through collective awareness and understanding, we can dismantle the stereotypes that hinder progress, creating an environment where individuals, irrespective of their health conditions, receive the dignity and support they deserve. Your role in this transformative journey is pivotal, as it empowers a shift towards a world where healthcare is inclusive, discrimination-free, and truly prioritizes the well-being of every individual. Now, as we conclude this transformative journey into the unseen narratives of sickle cell and the pervasive issue of race-based discrimination, envision a world where the intricate dance of 35 trillion red blood cells becomes a symbol of unity rather than a source of disparity. The narrative we've explored is not one confined to the confines of genetic mutations or healthcare statistics. It's a story of resilience, strength, and triumph over the barriers and narratives that it's not just tales of sickle cell. There are stories woven into the broader fabric of our diverse world. The power to reshape these narratives lies within each of you, dear listeners. By taking action, engaging with these stories, and challenging preconceptions, you become agents of change. This isn't merely a call to awareness. It's an invitation to embark on a collective journey towards a more compassionate and informed healthcare landscape. Imagine the profound impact your understanding and empathy could have, not just on those living with sickle cell, but communities facing discrimination based on health conditions worldwide. Let this tech export be a catalyst for change, an impetus for a new reality, one where the symphony of our 35 trillion red blood cells harmonizes with the melody of compassion, understanding,